Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. The National Medical Forum has written to Prime Minister Narendra Modi urging him to consider those medical students who have been evacuated from Ukraine as war victims. The National Medical Forum has written to Prime Minister Narendra Modi urging him to consider those medical students who have been evacuated from Ukraine as war victims. The letter reads that by Geneva Convention, these migrations were forced and as a result of the unfortunate war between the two countries, leading to a loss of fruitful employment and living opportunities and thus these displaced and migrated students should be considered as war victims. After PG, government doctors need to give services for 10 years continuously. Lucknow MBBS doctors in government hospitals going for PG medical courses via NEET PG counselling will have to serve at government facilities continuously for 10 years, failing which they will have to pay an amount of ₹1 crore to the government. Doctors applying for Diplomat of National Board DNB, a 3-year postgraduate master's degree, can pursue the course in a hospital only if they have 3 years of service. Rural area cannot be close to city. Madras High Court denies incentive marks to doctor. Holding that a rural area cannot be close to the city, the first bench of the Madras High Court has rejected an appeal from a doctor seeking incentive marks for admission in a postgraduate course on the ground that he was working in a government hospital in a rural area. The first bench of Chief Justice M.N. Bhandari and Justice D. Bharata Chakravarti clarified that the incentive marks have been provided to promote the medical services in certain areas which include difficult locations in hill, plains, remote and rural areas. No more ad hoc appointments. Central government defines uniform policy for hiring SRs and JRs. With an aim to bring equity and transparency in the recruitment process at central government hospitals, the Director General of Health Services has decided to put a stop to the practice of ad hoc appointment and introduce an uniform policy for selection of non-academic SR and GR of dental and other departments. In order to bring equity and transparency in the recruitment process, a standardized policy has been formulated for the recruitment of GR and SR for dental and other departments in a meeting held under the chairmanship of DGHS on 8 March. All central government hospitals under the administrative control of DGHS are requested to follow the newly framed recruitment policy with immediate effect and complete and selection process in rational and time-bound manner, read the order issued by DGHS. Early signs and symptoms of autism spectrum disorder in children. As per the WHO, about 1 in 160 children has autism spectrum disorder. Autism spectrum disorders are a diverse group of conditions which are characterized by some degree of difficulty with social interaction and communication, a typical pattern of activities and behaviors like difficulty with transition from one activity to another and unusual reactions to sensations. Despite having a number of distinct signs, autism is often not diagnosed until later, though it can be detected from early childhood. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.